Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the retinopathy of prematurity, there is a treatment for retinopathy of prematurity, which is early treatment of retinopathy of prematurity classification. According to the early treatment of retinopathy of prematurity classification, first type 1 retinopathy of prematurity should be treated. What is type 1 retinopathy of prematurity? Type 1 retinopathy of prematurity means Zone 1 with any stage of retinopathy of prematurity with a plus disease is type 1 retinopathy of prematurity. Plus disease means having arteriolar and venous dilatation is plus disease. Then we have zone 1. Second type is zone 1 stage 3 retinopathy of prematurity with or without plus 3. Zone 1 any stage with plus disease is type 1 retinopathy of prematurity which should be treated. Zone 1 stage 3 retinopathy of prematurity with or without plus disease is also a type 1 retinopathy of prematurity which should be treated. Then we have zone 2 stage 2 or stage 3 retinopathy of prematurity with a plus disease. Then we have type 2. Type 2 retinopathy of prematurity should be observed and it is treated only if progresses to type 1 or threshold disease, and it is treated if it progresses to type 1 disease or threshold disease. So what is type 2 actually? Type 2 is two types again. It is zone 2 stage 1 or stage 2 retinopathy of prematurity without plus disease, and zone 2 stage 3 retinopathy of prematurity without plus disease is type 2. Then what is threshold disease? Okay, threshold disease means threshold disease means anything which stage 3 involving either zone 1 threshold disease is threshold disease is anything involving stage 3 zone 1 and zone 2. Stage 3 disease involving zone 1 and zone 2 location, and this stage 3 disease involving zone 1 and zone 2 is also associated with -5 contiguous clock hours or 8 non-contiguous clock hours with plus disease. That means if this is the clock, any 5 continuous clock hours. Okay, if there is disease in any 5 continuous clock hours involving any 5 contiguous clock hours or any 8 non-contiguous clock hours along with plus disease, along with if it belongs to stage 3 disease involving zone 1 and zone 2, then it is called as threshold disease. Right, what is plus in this case? Actually, plus disease means if arteriolar and venous dilatation is present, then it is plus disease. So this is the classification according to early treatment of retinopathy of prematurity.
thank you and thank you for watching.